Hi, today we are going to be talking about the triple aim in healthcare. My name is Michael Serban, and joining me is Harry Lee and Roy Cavalier. So what is the triple aim? It is a framework that describes an approach to optimizing health system performance by looking at three dimensions. These dimensions are improving the patient experience of care, improving the health of populations, and reducing the per capita cost of healthcare. Why do we need the triple aim? Currently, the United States has the largest total spending in healthcare, with healthcare costs accounting for 17% of our gross domestic product, and suspected to continue to increase in the coming years. However, just because we are spending more doesn't mean we are getting more. As can be seen in this graph, the U.S. not only isn't leading comparable countries in effective care, but we also lag behind in efficiency, access, and life expectancy. Because of this, a value-based approach encompassing cost, satisfaction, and effectiveness, i.e. the triple aim, was developed so that all healthcare professionals are accountable and responsible for all the dimensions to improve the healthcare system to come.
So the patient experience is arguably the most important piece of the triple aim, because not only does it incorporate the cost, but the care and the satisfaction that the patients are getting from all areas of healthcare, and that goes from their initial visit to insurance to pharmacy to transitions between each of those. So it's a really important piece of the triple aim. How do we assess the patient experience, and what do we do with the data, and how do we carry out these plans? It's a pretty hot topic in healthcare nowadays. There are many metrics that have been in place, so like surveys or focus groups, direct interviews of patients. And these are used to help the institutions really find areas that are lacking or deficient so they can allocate more resources to those. One survey in particular that's being used is the Hospital Consumer Assessment of Healthcare Providers System survey, which basically it's a patient perspective of the care that they're getting. So is it quiet in the hospital, or are they being attended to quickly? And they can use that data to try and find how they rank as far as patient experience. And there are some other methods out there. So what do we do with that data? And that's even a more important piece than actually collecting the data. And there's not really a good answer for that. One thing that people are doing is just looking at the data, finding those areas of deficits, and allocating more resources to those. So there will be more in the future to see how they actually implement those, and we will be waiting to see that.
One of the key components of the triple aim is improving population health, and this essentially entails population health management, where it is considered it's a little broader than just disease management, and also includes intensive care management for individuals at the highest level of risk, and personal health management for those at lower levels of predicted health risk. And what defines a population is the concept of enrollment or registry that tracks a defined group of people over time, where we could take a look at certain defined metrics to determine the health of a population. Traditionally, or most commonly used, are probably life expectancies, infant mortality, but the success of improving being able to measure the improvement in health, it will be determined by the quality of data or evidence that we can gather. And ultimately, the priority of improving population health it'll be achieved through by reducing health inequalities among different population groups due to social, economic, environmental, and cultural factors, implementation of preventative health care, screening, and the availability of family planning and things of that nature.
The last aim is reducing the per capita cost. As we have talked about before, the cost of the U.S. healthcare system is getting out of hand. To control this, the triple aim encourages all practitioners to take responsibility for healthcare costs. Furthermore, cost-effective approaches to healthcare, such as increasing preventative medicine access to deter hospitalization and emergency department visits, and reducing throwing large quantities of money at the end-of-life care, are key at curtailing the current rise in healthcare costs. However, it isn't about reducing access or stopping the use of high-priced drugs, but rather lessening the use of low-value drugs that provide lesser clinical benefit for their associated cost. And those three components are what make up the triple aim. We want to thank you for listening, and I hope you have learned a little bit about the new framework for the U.S. healthcare system.